And of course, we're so excited to have this competition going. Now, in section 1, teams will be asked questions alternately with 10 seconds to answer. Each correct answer is worth 1 point. Of course, we're going to begin with Team NHT, and our first question is, what is the name of a treatment for cervical cancer or pre-cancer that uses a cold probe to freeze off cells? The time has passed. Would you like to try, Team CB? Would you like to try?
Sure. Freeze blasting.
Freeze blasting is incorrect. It's cryotherapy. Your question, CB Group, what is the 4th most common cancer in women globally? Time has passed. Would you like to try, Team NHD?
Sure.
Go ahead.
Cervical cancer.
That's correct. Team NHD is still with you. Time in FIT, that's F-I-T-T-E, refers to?
Frequency.
On the time.
Judges?
On time.
Not quite. Would you like to try, Team CB Group?
Frequency, intensity training.
Just say. Frequency, intensity, time, and type.
Not quite. The answer we're looking for is the duration of activity. So with you, CB Group, list 3 symptoms of tuberculosis. Time has passed. Would you like to try, Team NHD?
Sure.
Coughing,
Fever and chills.
Will we take it? We'll take it. So the possible answers: persistent cough, weight loss, fever, night sweat. So we'll take chills. That's correct. 1 point for you. Team NHT, you're still with you. How many new cases of breast cancer were there in females in 2022 in Jamaica?
1,261.
Not quite. Would you like to try, CB?
1,220.
Incorrect. It's 1,327 new cases of breast cancer in females in 2022. Team CB, your question. Finish this statement. About 1 in Jamaicans live births have a diagnosis of sickle cell trait.
1 in 5.
Incorrect. Would you like to try, NHD?
100.
Incorrect. It's 1 in 10. Team NHD said with you, what should the sodium or salt intake be for a sick person?
Less than 1,500 grams.
Incorrect. It's dependent entirely on their specific illness and their doctor's advice. So not quite. CBE, your question, what is the recommended sodium intake for a healthy person? What should they not exceed?
The 1 teaspoon.
Yeah.
2,300 milligrams is in fact correct. NHD, what are 3 healthy fats that can be included in your diet?
Exercise.
Fats.
You said facts or facts?
I said fats, but I'd say the wrong answer came first. So the answer we're looking for is avocado nuts or ackee. Team CB, what is the primary muscle worked in push-ups?
Triceps.
Incorrect. It's chest pectorals. Team NHT, true or false, can ARVs be dissolved in liquids?
False.
That's correct. They must be taken whole. True or false, Team CB, I should stop condom usage if on PrEP?
No.
False.
That's right. Who can take PrEP? That's for you, Team NHT. And I think that's the end of the segment. However, the question was asked, so you can go ahead and respond.
Who can take?
But can be taken by persons
Who are HIV
negative
and are exposed to being at risk to the virus.
They have multiple sex
So we'll
partners,
take it.
men-
HIV negative people at risk, which means we must balance out the timing. So Team CB, you get the opportunity to answer the last question in this segment. Which gender is more at risk for STIs?
Female.
Male.
Incorrect. It's women due to biological factors. And that's the end of section 1. Please give the teams give yourselves a round of applause. So we're going to take a quick break to double check those scores, and when we return, I'll have your results, and we'll head straight into the exciting section 2, where teams will have 60 seconds each to answer as many questions as possible. We'll be right back. "60 seconds on the clock. Again, we begin with Team NHT. What is the most common age for prostate cancer?
40.
Incorrect, it's 50. What is the importance of vitamin C?
For your immunity.
Will we take it, judges? Preferred answer is immune function and tissue repair. We'll check that one after. What percentage of cancers could be prevented?
90.
Incorrect, it's 50%. How is tuberculosis spread?
Airborne.
Will we take it?
Water.
Through airborne droplets,
Droplets.
but
Droplets.
judges indicate I will take it. Binge drinking is defined as
Pass.
drinking enough to reach blood alcohol content, BAC, greater or equal to, greater than or equal to 0.8, 0.2 in 2 hours. What does BMI stand for?
Body mass
mass
index.
index.
That's right. What does NCD stand for?
Non-communicable disease.
That's correct. What is the benefit of eating vegetables?
Help the body glows.
Not quite. Low in calories and high in nutrients. How much sodium is in a teaspoon of salt?
2,300.
milligrams.
Correct. What is prostate cancer?
Cancer of the prostate gland.
Not quite the answer we're looking for. It's a growth of cells that start in the prostate. Incorrect. What is overtraining?
Training too much where the muscle gets extra fatigued and damaged.
We'll take it. Exercising too much without enough rest. What is the earliest form of breast cancer called?
Pass.
In situ. What if I miss a dose of my PrEP medication, what will happen? Or what should I do?
You should take
do
it at
not-
the earliest possible time and get back on your regular schedule.
Do not take
We'll
double.
take it. What is circuit training?
Circuit training doing multiple exercises in a set. So like 3 different or more type of exercises.
We'll take it. Series of exercises with minimal rest. What's a fitness plateau?
It's at the point where you can no longer, where you can pass this level of fitness.
You're stuck.
When progress in training stops, we'll take it. Name one benefit of early detection of NCDs.
Can be treated successfully.
Well, we're looking for prevent complications, improve quality of life. I don't think we'll take that one. That's incorrect. How many children get cancer each year globally?
About 200,000.
Incorrect. It's approximately 400,000 children get cancer each year. What is anaerobic capacity?
Anaerobic capacity.
And we don't have time for that question. Your 60 seconds is up. Well done, Team NHT. It's now time for your 60 seconds, Team CB. Are we ready? No. Physical activity improves what, Team CB group?
Fitness.
Circulation.
Not, I'm seeing our judges saying maybe, so I'll asterisk that. Muscle strength is the answer we're looking for. In which part of the body does prostate cancer arise?
Prostate glands.
Okay, that's correct. What is a healthy diet?
A diet consisting of 6 food groups in moderation.
I will take it, eating a variety of foods from the 6 food groups daily. Where can I get PrEP?
At health centers or
We'll take it to
Yeah.
participating pharmacies.
Yeah.
What is a mastectomy?
mastectomy is the removal of cancer cells in the breast.
Incorrect. It's a surgery that removes the whole breast. What is one of the ways to find breast cancer early?
Early detection.
Mammograms.
Mammograms. Early mammograms.
We'll take it. Being aware of the signs and symptoms,
Yeah.
self-examination screening, which would include mammograms, that's correct. What is the normal function of the kidney?
To filter blood.
Waste.
Filter away from the body.
That's correct. We'll take it. How long for an STI to show up? How long does it take for an STI to show up in a fast test? Sorry, in a test.
It depends on the duration of the FCI.
And
20
the answer we're
minutes.
looking for is usually
20.
within 6 to 12
20.
weeks. I take that to be your final bell. Your 60 seconds are up. And that's the end of your 60 seconds and the end of section 2. We're going to, of course, take some time to double check those scores. And when we come back, we'll have the ding dong buzzer section. Don't go anywhere. Hello, everyone, and welcome back. This is Section 3 in the first quarterfinal match of our Health Knowledge Quiz brought to you by the Ministry of Health and Wellness. And again, this is a part of our Corporate Wellness 8x8 Challenge. Now, let's get straight into the action. In Section 3, teams will get the chance to buzz in. Once they buzz in and they wait to be identified, once their answer is correct, they'll get 2 points. But if their answer is incorrect, incomplete, or if they fail to wait to be identified, they get away this time, they lose 1 point. So it's a risk or reward in this section. Teams are ready, and we begin. How much does PrEP cost locally? Team NHT?
Free.
That's correct. How many new cases of prostate cancer were there in males in Jamaica in 2022? $1,599. Which habit improves both blood sugar and heart health? Team CB?
Regular physical activity.
Or regular exercise, that's correct. If I take PrEP and I am HIV positive, what happens? Team NHT?
Stop taking PrEP and go to, and they put you on the antiretroviral virus medication. Okay, so you stop taking PrEP and you'll be transferred to the antiretroviral virus treatment and be referred to health centers and healthcare facility to continue.
Not quite, and the time is out. Nonetheless, it can cause treatment failure, is the answer we're looking for. Fast response and treatment to stroke is critical to prevent. So fast response and treatment of stroke is critical to prevent brain damage. Which virus is commonly associated with cervical cancer? Team CB?
HPV.
The human papillary virus.
HPV.
HPV.
I don't know.
I think the wrong answer came first. It would be the human papilloma virus. HPV came after papilloma, so not quite CB, incorrect. What is a good warm-up activity? Team NHT?
Jumping jacks.
Oh, stretches.
Not quite. Slowly, walking slowly is a preferred answer. What is a breast cancer tumor made of? Abnormal breast cells. What is one sign of overtraining? What is one sign of overtraining? Go ahead, Team CB.
Stress on your muscles.
We'll take it. Chronic fatigue. Which activity improves physical speed? Team CB.
Running.
I'm looking at our judges. I'm seeing an ish, not quite. The answer is that we're looking for is sprinting. What is the most common symptom of colorectal cancer? Team CB.
Blood in feces.
Incorrect. It's changes in bowel habits. What is the benefit of drinking water instead of Team NHT?
Cleansing of the blood.
And the cells within the body.
What is the benefit of drinking water instead of sugary drinks? The answer we're looking for is reduced calorie intake, so I don't think we'll take the response given. That's incorrect. What is the purpose of surgery for breast cancer? Team NHT.
To remove the cancerous breast.
Or tissues within the breast.
We'll take it to remove the breast tumor. What is the primary cause of cervical cancer? Team CB.
HPV.
Reprieve in this one, yes. HPV is correct. What is the primary function of protein in the body? Team CB.
Repairing muscles and tissue after exercise.
We'll take it building and repairing tissues. Who should take PrEP? Team CB.
Anyone that is sexually active, especially if they are at risk for HIV.
We'll take it. It's best for
Negative.
people. We'll still take it. I see our judges nodding. It's best for people at high risk. What is the medical term for cancer affecting the large intestines or the rectum? Team NHT.
Colorectal.
Colorectal
cancer.
Or colon cancer, that's correct. What is the normal blood pressure reading for adults? Team NHT.
120 over 70.
80. 120 over 80.
Incorrect. The answer we're looking for is less than 120 over 80 mmHg, which is a low impact physical activity. Team CB.
Walking.
We'll take it. Swimming is another option. Name a bilateral exercise. Team CB.
Push-ups.
We'll take it. Or squats. What should you check first when evaluating a nutrition label? Team NHT.
The level of sodium.
Level of sodium.
Or salt.
Incorrect. The answer we're looking for is serving size information. What is exposed? Well, what will happen if exposed to TB? Team CB.
You will begin to display symptoms, so shortness of breath, fever, chills. If you're exposed, you may also become infected.
I'm going to look at my judges.
And can also.
We'll,
Yeah, I was thinking that.
all right, so we'll check on that one. Which nutrient is known as the body's primary energy source? Team CB.
Carbohydrate.
That's correct. Final question in this match. Consistency in exercise leads to? Team NHT.
Better physical.
Success in exercising.
Yeah, go on, say no, say no.
Say no, say no.
That will increase your physical fitness and
The working of your
Well, your
Bobby.
10 seconds are up. I'm looking at our judge. Are we going to take that? We'll take it, or simply the answer we're looking for is progress. So, that's it for our very first quarterfinal match. Of course, we're going to take a quick break to double check those scores. When we come back, I'll give you the final results. You don't want to go anywhere. Welcome back. The scores have been checked and the results are final. Our winner for this first quarterfinal match is Team CB Group on 21 points and Team NHT, who did very well in the competition, on 15 points. So at this time, we invite the captains of both teams to come forward and shake hands in the true spirit of sportsmanship. And just to let you know, ladies and gentlemen at home, that these are people who work for the various companies and they've put themselves forward to be a part of this very, very exciting competition. Once again, this is the very first quarterfinal match in the Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness. It's a part of the Corporate Wellness 8x8 Challenge, and this is the 8th challenge. So, of course, we're winding down. Just to let you know before we go, ladies and gentlemen, that one of the queries that came in was on the response to the question, what is the normal blood pressure reading for adults? And we know here in Jamaica, you'll hear 120 over 80, but the correct reading is really less than 120 over 80. So we know you might have that query as well, so we want to clear the air. And this is all for information and for your knowledge at home. So we thank you so very much for watching. My name is Javon Keys. Don't go very far, because guess what? The next quarterfinal competition is coming right up shortly. See you soon.
But they go before me, make sure. If they ask me that, if God don't be drip. No? I'm on. What you call it? Impossible.
So we're going to do a live check. So I'm going to walk by you individually and ask you to speak. So everybody else can just please. Just here. I'm just going to ask you to just talk.
Tell my name.
Just check it out. Just speak.
Come on, just start. Start now? Oh, I'm Maxine Letman.
Keep talking. Keep talking.
Keep talking. I'm from Mona School of Business and Management.
Keep talking.
How are you, Nordia?
I'm quite fine.
Okay, just 1, 2, 3, 4. You're good?
1, 2, 3, 4.
Keep talking. Keep talking. Keep talking.
Hello everyone and welcome to match 2 in the quarterfinal round of the Health Knowledge Quiz brought to you by the Ministry of Health and Wellness. Of course, it's a part of the Jamaica Moves initiative, particularly the Corporate Wellness Challenge 8x8 edition. And guess what? This is the 8th challenge. Now, of course, in this matchup, we have Seprod going up against the Mona School of Business and Management, MSBM. An exciting matchup it will be. Of course, we'll begin with Team Seprod introducing themselves.
Hi everyone, my name is Antonio Ross.
Hi, my name is Katrina O'Sullivan.
Hi, my name is Courtney Ann Parks.
Hi, my name is Mona Lee Bailey.
Thank you so very much, Team Seprod. Now let's meet the team from MSBM.
Hi, my name is Maxine Letman Hall.
Hi, my name is Nardia Lawrence.
Afternoon, I'm Astronaut Sharp.
I'm Ingrid Nelson.
Thank you so very much, Team Mona School of Business and Management. Now let's get straight into the action. In section 1, teams will be asked questions alternately with 10 seconds to answer. Each correct answer is worth 1 point. Of course, this section lasts for 5 minutes, so with that time on the clock, we begin with Team Seprod. What happens if I miss a prep dose?
You can either take it as soon as you realize if it's on the same day, or if you miss the whole day, you just continue as normal.
Take it as soon as you remember. That's it. We'll take that answer. You're correct. MSBM, what's the best way to avoid a fitness plateau?
You can stop when you get to that point.
At the relevant intervals.
At the exercising.
Not quite. Vary the workout routine is the answer we're looking for. Team Seprod, what is a sign of early stage cervical cancer?
Go ahead.
Blood in the urine or pee of the female.
Could you go again?
Blood in the urine or pee of the female.
We won't take it. The answer we're looking for is unusual bleeding between periods, after menopause or after sexual intercourse. So not quite blood in the urine. MSBM, what are the major genre or gene mutations rather that greatly increase the risk of breast cancer?
BRCA1 and 2.
Correct. Another possible answer could have been as well PALB2. Now, for your question, Seprod, true or false, STIs can be spread through unprotected anal sex.
True.
That's true, and that risk is very high. MSBM, true or false, when I get tested, my results will be broadcast to others.
False.
That's correct. HIV testing is confidential. Team Seprod, what mineral is crucial for building and maintaining strong bones and teeth?
Calcium.
That's correct. MSBM, what is the function of the mitochondria in exercise?
Provide energy.
We'll take it. It produces energy in cells. Seprod, what's the main goal of rehabilitation exercises?
To regain strength after an injury.
Or restore function after injury. That's correct. MSBM, what is the main role of dietary fiber in digestion? So what we're looking for is help with digestion and maintaining a healthy digestive system. So will we take the answer given? No, we will not. So that answer is incorrect, MSBM. Seprod, in what region are the highest rates of cervical cancer?
The Caribbean region.
Not quite. We're looking for Sub-Saharan Africa, Central America, and Southeast Asia. MSBM, what is another name for metastatic prostate cancer?
End-stage prostate cancer.
We'll take it. So stage 4, advanced prostate cancer, but we'll take that answer. Team Seprod, true or false, can PrEP give me HIV?
False.
That's correct. Team MSBM, true or false, HIV can be passed without ejaculation during sexual intercourse?
True.
That's correct. HIV is present in pre-ejaculatory fluid. Seprod, what percentage of the total new cancer cases in Jamaican males were prostate cancer in 2022?
60.
Incorrect. It's 1%. MSBM, your question. Name the 3 types of treatments that are often combined to manage breast cancer.
Chemotherapy, radiation.
Surgery.
We'll take it. So chemotherapy, radiation, surgery is your combination. You also have medication. So we'll take it. That's correct. Seprod, what are common ARV side effects?
I want to say fatigue, dizziness, nausea.
Correct. Headache and rash are also other options. MSBM, true or false, condoms are reliable for STI prevention.
True.
That's correct. When used correctly, that is. How many new cases of prostate cancer were there in males in 2022, Seprod?
About 100,000.
Incorrect. There were 1,599 new cases of prostate cancer in males. MSBM, using a percentage, state the risk of developing cancer before the age of 75 years for a male in Jamaica.
50%.
Incorrect. It's 6%. Team Separate, if you can talk but cannot sing while working out, at what intensity are you exercising?
Level 8.
Level 8?
Yeah.
Out
High
of 10 or
intensity.
100?
High intensity.
Not quite. It's moderate intensity. That's the answer we're looking for. Team MSBM, your question, what's the primary purpose of a heart rate monitor during exercise?
To measure the amount of energy being expended.
We'll take it, or to track intensity of the exercise. What is the most important macronutrient for endurance athletes? Team Separate?
Glucose. Or carbohydrates.
The wrong answer came first. So carbohydrates is the answer we're looking for. Team MSBM, what is the primary benefit of cardiovascular exercise?
To burn and to burn calories and to increase the heart rate.
Looking at my judges. So not quite. So the answer we're looking for is improves heart and lung function. That's the answer we're looking for. Team Separate, what are the 4 main behavioral risk factors for cancer and other NCDs?
One.
Speak up.
That's okay.
One is family.
So hereditary disease, it would be hereditary. Poor diet.
Well, not quite. And I understand that our time is up, which means we must balance the questions asked, but the answer we're looking for: tobacco use, alcohol use, unhealthy diet, and physical inactivity, which brings us to the final question in the round. Team MSBM, what is the national goal for breast cancer?
Less than 2%.
Well, the answer we're looking for is to reduce premature mortality from breast cancer by 1/3 by the year 2030, a year synonymous for our own Vision 2030 as a country. That's the end of section 1. Of course, don't go anywhere. We're going to double check the scores, and when we return, we'll have the exciting speed section. Please stay with us. Welcome back. This is match 2 in the quarterfinal round of the Health Knowledge Quiz Competition brought to you by the Ministry of Health and Wellness. Of course, the teams in this competition for this particular match, Separate and Mono School of Business, MSBM, and coming out of section 1, the scores are Separate on 8 and Mono School of Business and Management, MSBM, on 6, which now makes way for the speed challenge. That should be Separate on 6 and Mono School of Business on 8. So now it's time for the speed section. Teams will have 60 seconds to answer as many questions as possible. 1 point will be allotted for each correct answer. No penalties for incorrect answers in this round. With 60 seconds on the clock for first team, we begin with Team Separate. What was the total number of new cancer cases in Jamaica in 2022?
2,500.
Incorrect, 7,500. Doing too much too soon can cause, while working out, sorry, let's skip that one. Kidney disease is often called a silent disease because?
Because there are no symptoms, it can be asymptomatic. There are no
We'll
visible
take it,
symptoms.
symptoms appear late. During exercise, pain may be a sign of what?
Fatigue.
Will we take it, judges? Please speak up. The answer given is fatigue. Will we take it? Incorrect. The answer we're looking for is injury. Seatbelt use reduces the risk of death in crashes by what percentage?
70%.
70% is right. True or false? If I start taking PrEP for HIV, I have to take it for life.
False.
That's correct. Only during high risk periods. Which test measures flexibility?
A stretch test.
And that's the end of your 60 seconds. Stretch test didn't come in time either, but the answer really is sit and reach test. But I understand that we might have been able to accept that if it came in time. It's now time for your questions. MSBM, 60 seconds on the clock, and it begins now. What is the role of fiber in digestion?
Digestion.
Will we take it? Okay, to regulate digestion by adding bulk to stool. So we'll just take the answer. Given in Jamaica, what is the most common cancer among males?
Prostate cancer.
That's right. How does sleep affect fitness?
Helps the body, the muscles to recover.
It helps recovery and performance. That's right. What are the 6 food groups?
Vegetables, staples, legumes,
Carbohydrates.
foods from animals, peas and beans, and fats and oils.
I see a nod in the negative. So carbohydrates, vegetables, food from animals, fruits, legumes, fats, and oils. That's what we're looking for. What vitamin is often associated with good vision and is found in carrots?
Vitamin A.
That's correct. True or false? Persons are able to contract STIs from oral sex. Don't have time for that. The answer would have been true. And that's the end of your 60 seconds. The end of section 2. We're going to double check the scores once again when we come back. The exciting buzzer section. Don't go anywhere. Welcome back. This is the final section of our second quarterfinal match in the Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness as a part of our Jamaica Moves Corporate Wellness Challenge. Now let's get straight into section 3. Of course, the scores are going to this section separate on 9 points and Mona School of Business and Management on 12. Now this is the ding-dong buzzer section. In this section, teams must buzz in and wait to be identified before giving their answer. Each correct answer is worth 2 points, but if they didn't wait to be identified, if them answer wrong, then they're gonna lose 1 point. So it's risk or reward in this section. With that said, our time is on the clock, and we begin now. What are essential nutrients your body needs daily? Team Seprod.
Go ahead.
Minerals, sugar, vitamins, fiber.
Judges? So I'm looking at our judges. We'll query that one, but the answers we're looking for: vitamins, minerals, protein, carbohydrates, and fats. I'll leave that one to the judges. Which activity is best for flexibility? Seprod?
Stretching.
Correct. List 3 benefits of healthier eating habits. Team Seprod?
Weight loss, good health, and
Increased energy.
Will we take those answers, judges? All right, so we'll take weight loss, but other answers, including energy level, which was given, is improved skin and hair. Next question, true or false? I take PrEP if pregnant. True or false? Can I take PrEP if I'm pregnant? Separate. I'm gonna take it that there was no acknowledgement there. The answer would have been true nonetheless, so you'd have lost the point anyway. True or false? PrEP can be taken for one night only. Team Seprod.
false.
That's correct. For adults at risk, how often should the blood pressure be checked? Team MSBM.
Twice.
Every time you visit clinic.
Not quite. We're looking for at least annually. How many cancer cases were there in males in Jamaica in 2022? Team Seprod.
1,599.
Incorrect. 3,713. How is the HIV test done? Team MSBM.
Swab, finger prick, or blood sample.
That's correct. All three right there. What are the three main components of the nutrition facts panel? Team Seprod.
Calories, serving size, daily value percentage.
All right, we'll take it to serving information or size, calories, daily percentage value, vitamins and minerals is the full answer, but we'll take that response. Which muscle group is used for pull-ups? Team Seprod. Failed to wait to be identified. You lost 1 point. What is one of the main risk factors for prostate cancer? MSBM.
Heredity, where a close family member had the disease.
All right, we'll take it. Older age is the main risk factor, however, but we'll take hereditary. What is the name of the cancer that affects the neck of the womb? MSBM.
Cervical cancer.
That's correct. What is the first sign of colorectal cancer often detected? Team Seprod.
Change your bowel movements.
Judges. We'll take it. We're looking for diarrhea, constipation, or blood in the stool, which indicates a change, so we'll accept it. What does flexibility help prevent? Team MSBM.
A lack of mobility.
Or injuries, that's correct. What is the most frequent cancer among females in Jamaica? Team Seprod.
Breast cancer.
Correct. Public awareness campaigns for alcohol and road safety aim to? Team Separate.
Reduce road fatalities per year.
We'll take it. Reduce alcohol abuse and crashes. Name one physical activity that strengthens the back. Team Separate.
Pull-ups.
Correct. True or false, TB still occurs in Jamaica. Team MSBM.
True.
That's true, but at low incidence. True or false, the exact cause of prostate cancer is always clear. Team Separate.
False.
That's correct. It's often not clear what causes it. What is the first step in diagnosing colorectal cancer? And we don't have time for that or any more questions. That is the end of the match. Now we're going to take a quick break. Don't go anywhere. We're going to double check those scores. And when we come back, I'll have the results for the second quarterfinal match in our 2026 Health Knowledge Quiz competition. Don't go anywhere. Welcome back to quarterfinal number 2 in the Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness as part of the Jamaica Moves program, particularly the Corporate Wellness Challenge 8x8 edition. Now, after an intense competition and a face-off with Separate and Mona School of Business and Management, the results are in. The final scores are MSBM on 21 and Separate on 23. So a close finish, but we say congratulations to both teams. Very well played. And we invite the captains of both teams to come forward and shake hands. Congratulations. Now this means that Team Separate will advance to our semi-final round of the competition. And we say thank you so very much to our teams, our judges, and our production crew here. My name is Javon Keys. Until next time, don't go very far because our next quarterfinal match will come to you in just a few minutes. So we'll see you at quarterfinal number 3 shortly. Take care. know, the team that wins this competition, well, this match will make their way into the semi-final round of our competition. So let's give you an idea of what you're about to get yourselves into. In round one, teams will be asked questions alternately, which means they may ask you one question and you can answer, and they may ask you one question. There's no penalty for incorrect answers. However, if it is that you fail to answer, you have 10 seconds to answer. If you don't say anything in the 10 seconds, hello and welcome to the third quarterfinal match in our Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness. My name is Javon Keys and I'm your quiz master for today. And in this match, we have Team National Library Service up against Team Mothers. Now, of course, we're going to ask the teams to introduce themselves, and we'll begin with Team National Library Service.
Hi, I'm Chantal from the National Library of Jamaica.
I'm Jermaine, also from the National Library of Jamaica.
I am Francina Francis, NLJ.
My name is Adolfo Stepaz, Reference Librarian, National Library of Jamaica.
Thank you so very much, Team National Library of Jamaica. And now let's hear from the Team Mothers.
Good afternoon, Jamaica. I'm Sanjay Henry.
Good afternoon, I'm Kenita McPherson.
Good day, my name is Christian Crossgill.
Hello, I'm Amoy Harridge.
Thank you so very much, team. So, as was said a short while ago, this is the third quarterfinal match, which means that the team that moves on from this particular match will make their way into the semi-finals. Now, in this section, teams will be asked questions alternately with 10 seconds to answer. Each correct answer is worth 1 point. And of course, with that said, we'll begin with Team National Library of Jamaica. According to WHO, what is considered a low-risk consumption of alcohol consumption for adults?
15%. 50.
0.8%.
Incorrect. The answer we're looking for is 2 standard drinks per day for men and 1 for women. Team mothers, in which types of countries are the highest rates of cervical cancer incidence and mortality found? Is it low income, low middle income, or high income?
Africa, low income.
Incorrect. The answer we're looking for is in low and middle income countries. Of course, you had those choices there given to you. So incorrect. National Library of Jamaica, what is the name of the sugar that the body uses as its main source of energy?
Glucose.
That's right. Team mothers, what is a healthy BMI range for adults?
Less than 75.
Well, pass came first. Would you like to try National Library of Jamaica?
15 BMI.
Incorrect. It's 18.5 to 24.5 to 9. Still with you, National Library of Jamaica, what is the ideal environment for outdoor exercise?
Ideal environment, cool. And obstruction.
In the early morning.
Yeah.
Not quite. Early morning is good because it's cool, yes.
Cool.
Dry and shaded, which is the answer we're looking for. Team mothers, your question, what is cross-training?
Cross-training is doing multiple exercises at different intervals.
And we'll take it using different exercises to improve fitness. That's correct, National Library of Jamaica. What can reading the nutrition facts panel help with?
The nutrition value of the source food.
And making informed decisions.
We'll take it. We'll take it. Making or choosing healthier foods. Mothers, your question, how does sweating help the body during exercise?
It aids in cooling down the body.
It regulates body temperature. That's correct. True or false? Can I contract an STI through kissing a person with a mouth sore?
True.
That's correct. Team mothers, why is a correct cancer diagnosis essential for effective treatment?
Because treatment varies based on the cancers that you have, so it is important to know what exactly you're treating so you can specialize treatment for that early.
I think we could take that one. Every cancer type requires a specific treatment regimen, so we'll take it. National Library, what is a healthy resting heart rate for adults?
Resting heart rate. I don't know. 80 beats per minute. 80 beats per minute.
But we're looking more for a range, so it's 60 to 100 beats per minute. So we can't quite take that one. What is functional fitness? That's for you, team mothers.
So it's fitness based on the required standards based on the exercise that you're doing?
We won't take that one. It's exercise that improves daily movement. That's what we're looking for. National Library of Jamaica, true or false, I can drink alcohol on prep?
No.
False.
Incorrect, it's true. But avoid missed doses. That's the important thing when taking prep. Now time for your question, mothers. How is TB tested?
Blood test.
Incorrect. I tell you, this is via the Manto skin test. So that's incorrect. National Library of Jamaica, which body system benefits the most from regular exercise?
Cardiovascular.
That's right. Which macronutrient is often referred to as the body's primary fuel source, mothers?
Carbohydrates.
That's right. National Library. What were 3 of the most common causes of cancer death in 2020?
Late detection.
Diet.
Age and diet.
You won't accept. So it's either from lung, colon, and rectum, liver, stomach, or breast cancers. Those are the most common ones. Team mothers, what is the 4th most common cancer in women globally?
Cervical.
That's right. Team National Library, what is the risk of dying from cancer before the age of 75 years for females in Jamaica?
30?
25.
20 to 30%.
Incorrect, 2%. Team Mothers, what is the estimated global mortality from breast cancer in 2022?
6 million.
Incorrect. So breast cancer caused an estimated 670,000 deaths globally. Team National Library, which physical activity improves coordination the most?
Coordination. I don't know. Running. Nope.
Incorrect. It's something I can't do. It's dance. Mothers, true or false? Can I take PrEP only on days I'm sexually active?
False.
That's correct. National Library in Jamaica, what are the names of the 2 cancer treatment centers of excellence?
Hope Institute of
Jamaica Cancer Society.
Incorrect. It's St. Joseph's Hospital and Cornwall Regional Hospital. Team Mothers, which other NCDs, that's the communicable diseases, are included in routine Ministry of Health and Wellness screening guidelines besides cancers?
Diabetes, hypertension.
Correct. Depression, sickle cell disease are also 2 other answers that could have been provided. National Library PrEP side effects include?
Nausea and
dizziness
and fatigue.
Nausea and fatigue would be preferred, but dizziness came first, so we can't accept, unfortunately. So mild nausea, headache, tiredness are the preferred responses. Team Mothers, vigorous intensity physical activity makes you dash.
Yes, makes you. Tired.
That's one way to look at it. I'm looking at our judges. We take it? Not quite. It does, however, make you breathe faster and sweat. So that's the answer we're looking for. Team National Library, which of the following is a primary health risk associated with consuming too much sodium? Hypertension or high blood pressure, or pressure as the Jamaican people say. Mothers, what can help you choose healthier foods at the grocery store?
The nutrition facts label and ingredients on the packaging.
Reading maketh a full man. That's correct. National Library, what is the main message about early detection of cancer?
Early detection save lives.
That is correct, right on the head. Mothers, what is the percentage of new cancer cases for males in 2022 that were prostate cancer?
20%?
Incorrect, it's 43.1%. How many new cases of breast cancer were there in females in Jamaica in 2022? Team National Library?
3,700. 3,700.
Not quite. It's 1,327. Team Mothers, your question. How much more likely are women living with HIV to develop cervical cancer?
75%.
Incorrect. 6 times more likely. Team National Library, what are the units that measure the amount of energy you get from food?
Kilocal.
That's right. What does a balanced diet typically include, Team Mothers?
Carbohydrates.
Food from all the food groups.
Vitamins, minerals, fats and oils.
Protein.
I'm looking at my judges. I don't know. My judges are consulting the answers we're looking for: staples, fruits, vegetables, food from animals, peas or beans, fats. Judges, we're going to stick a pin in that one, but that's the answer we're looking for. Team National Library, which component of fitness is not a component of skill-related fitness?
Which component of fitness is not?
Aerobics.
Aerobics.
Incorrect. Flexibility is what we're looking for. And Your question, team mothers, what type of fat is generally considered unhealthy and should be limited in the diet?
Saturated and trans fat.
That's right. Team National Library. And I think that's the bell. And that's the bell. Ladies and gentlemen, that's the end of section 1. We're going to take a quick break to double check those scores. When we return, I'll tell you what the official scores are, and then we're going to move into the exciting speed challenge. Which team will have quick thoughts? And I'll tell you which one, and you'll see which one right after this break. Stay with us. Welcome back. This is section 2 in our third quarterfinal match for the Ministry of Health and Wellness's Health Knowledge Quiz Competition as part of our Corporate Wellness Challenge 8x8 edition. Of course, this is our 8th challenge in the series. Now, of course, in this match, we have National Library of Jamaica up against Team Mothers, and the scores are Team National Library of Jamaica on 7 and Team Mothers now on 10. Team Mothers, in fact, gained a point for their response to the question, what does a balanced diet typically include? So they listed almost all of the various food groups, and the judges have accepted their answer. So that leaves us at the point standing where we are, which takes us nicely into our speed challenge. In this section, teams will get 60 seconds to answer as many questions as possible. 1 point will be given for each correct answer. With that said, again, we begin with Team National Library of Jamaica. Europe. What is the risk of dying from cancer before the age of 75 years for a female in Jamaica?
Pass.
11.2%. Give a reason why it is important to eat breakfast.
Energy. Improved energy.
We'll take it. Help with concentration and focus. Name one organ that can be damaged by uncontrolled hypertension.
The heart.
That's correct. Kidney or brain are two other answers. Climbing stairs improves.
Cardiovascular health.
Looking at my judge, they'll take it. Lower body strength and endurance is the preferred answer, but we'll take that one. What is what's plyometric exercise?
Pass.
Explosive movements like jumping. That's one for our friends at GC Foster College, which is an example of type in FIT. That's F-I-T-T-E. What's that?
Endurance.
Not quite. Aerobic strength, anaerobic. Oh, we'll take endurance. So you've gotten that point. Endurance. Good guess, and right on the bell. So that's the end of your 60 seconds. It's now time for your 60 seconds, mothers. And the time starts now. What is the purpose of medication for breast cancer?
To treat the illness.
Slow growth of the cancer and to prevent
So we'll
it from
take it to
spreading.
kill cancer cells and prevent them from spreading. That's right. What is a common treatment for cancer that involves using chemicals?
Chemotherapy.
That's correct. What is the second leading cause of cancer-related deaths worldwide?
Pass.
Colorectal cancer. What is the most common cancer in women?
Breast.
That's correct. Name one simple tool for self-monitoring blood sugar at home.
Blood pressure machine.
Incorrect. Glucose monitor, not blood pressure. What is the number of deaths from prostate cancer in Jamaica in 2022?
Pass.
829. Where does digestion begin?
Mouth.
That's correct. Warming up before exercise prepares where?
What?
And warming up before exercise prepares your body and heart for the intense workout that you're about to endure. That's it for your 60 seconds, and that's it for section 2. So please stay with us. We're going to take a quick break, but when we come back, we'll have the exciting buzzer section. This is our penultimate quarterfinal match in our health knowledge quiz competition, the first of its kind, brought to you by the Ministry of Health and Wellness through its Jamaica Moves campaign. Don't go anywhere. Section 3 will be right after these messages. Welcome back. This is the third quarterfinal match in the Ministry of Health and Wellness Health Knowledge Quiz Competition, brought to you, of course, by Jamaica Moves, and it's a part of our Corporate Wellness Challenge 8x8 edition, and this is the 8th and final challenge. Of course, our teams in this match, they are National Library of Jamaica and Team Mothers. And of course, my name is Javon Keys, your host. So coming out of section 2, the scores are Team National Library, 11 points, and Team Mothers on 14 points. But guess what? It all comes down to this. This is the ding-dong buzzer section. In this section, once teams buzz in, they must wait to be identified. And if they don't wait, guess what's going to happen? They're going to lose 1 point. If their answer is correct, they'll gain 2 points. If their answer is incorrect or they fail to answer, they'll also only lose 1 point. So it's still a risk or reward, but it's in good sportsmanship. With that said, we have the time for this section on the clock, and we'll begin now. What is a common consequence of iron deficiency? Team National Libraries.
Low energy?
Not quite. The answer we're looking for is anemia. What is the superset? What is a superset in strength training? Two exercises done back to back without rest. True or false? Condoms are the only STI protection or prevention. Team Mothers.
False.
That question, we're gonna move past that one. The answer would be false, and I think we can actually take that question, that response from them. So that's correct. Which screening tests for prostate cancer are recommended by the Ministry of Health and Wellness? Team Mother? Oh, no one buzzed in. My apologies. Digital rectal examination, DRE, or prostate-specific antigen, PSA test. What are the two main components of early detection for cancer? Screening and early diagnosis. Cooling down after exercise helps to dash. Team National Libraries.
Cool the body. Cool the body. Allow the muscles to rest. Cool the body. Cool the body.
Not quite. We're looking for lower the heart rate gradually. What is it called when cancer spreads to other organs? Team Mothers.
Metastasis.
That is absolutely correct. What does cool down mean in exercise? Team Mothers.
What do I cool on the heart rate and rest
Allow
your
the body
muscles?
to relax.
And to stretch.
Looking at our judge, he'll take it, gradually returning to a resting state, which is a common sign of dehydration. Oh. Team National Library.
Thirst. Intense
Not
thirst.
quite. Looking for dark yellow urine as one of those indicators. True or false? If I am living with HIV, I can substitute my medication for merengue pills. Team National Library.
False.
False.
That's absolutely false. What percentage of the total new cancer cases in Jamaican females were breast cancer in 2022? Team Mothers.
1.2%?
Incorrect. It's actually 0. That's 0%. Team, well, 0%. What are important nutrients found in dairy foods? Team National Library. Calcium is incomplete.
And protein. I said on protein.
Well, I think I see our judge nodding, so we'll take it. It's calcium, vitamin D. Those are the two answers. So you've gotten your 2 points. No worries. What does the U equal U related to HIV? Team National Library?
Undetectable equal untransmittable.
Related to HIV management mean? That is correct. In which month is Cervical Cancer Awareness Month commemorated in Jamaica? It's the month of April. True or false, walking 30 minutes a day can improve cardiovascular health. Team National Library.
True. True.
That's correct. What is the benefit of cross-training? Team Mothers.
Cross-training allows you to train different body groups and conduct different exercises to help with overall health.
Simultaneously.
We won't take it. It reduces injury and improves performance. That's the answer we're looking for, so that's incorrect. Protein is provided by which food groups? Team Mothers.
Food from animals.
Peas, beans, and nuts. That's correct. Or I'm looking at our judge, and we needed 2, so not quite. So food from animals is 1. Peas, beans, and other nutrients is what we'd take. So that's, you can't take that. And that's it. Eso es, como lo dicen los españoles. The Spanish would say eso es. That is it. We're going to take a quick break. When we come back, I'll give you your final scores, and I'll tell you which team will make it to the semifinal round. Don't go anywhere. Welcome back. This is quarterfinal 3 in the Ministry of Health and Wellness's Health Knowledge Quiz Competition 2026. Now, we're down to the final scores after our third match, and they are National Library of Jamaica on 16 points and Team Mothers on 18 points. So pretty close scores, but guess what? Team Mothers will now make it to the semi-final round of our competition. So congratulations to both teams, but special congrats to Team Mothers. Clearly you're cooking up something over there. So at this time, we invite the captains of both teams to come forward to shake hands in keeping with our quiz show of sportsmanship. So with that said, that's it for our third quarterfinal match, or penultimate, and if you've been here from the start, you get the gist. We have one more match to go, so you're not gonna go very far, but if you need to get some tea or for some reason you need to go do some pickup now, we understand. But you can come back to the Ministry of Health and Wellness's YouTube channel to catch all of the action. But we're gonna take a quick break. We'll see you shortly, and the final quarterfinal match will be right after these few messages. Don't go anywhere.
Well done.
Yeah.
Good job.
Hello everyone and welcome to the last quarterfinal match in our Health Knowledge Quiz Competition 2026. Of course, it's brought to you by the Ministry of Health and Wellness, particularly as a part of our Corporate Wellness Challenge 8x8 edition. And of course, this is our 8th challenge in the series. Of course, that also forms a part of the Jamaica Moves initiative where we're trying to get Jamaicans to be active. And of course, we're selling the healthy living theme. Now, with that said, it's our last quarterfinal match, so if you've stuck around from the very start, we're so happy that you're still here with us. Of course, those of you joining us from across the world on our YouTube channel. My name is Javon Keys, and the pleasure is mine to continue to be your host as we have Team Forestry Department going up against Team E-Learning Jamaica. So with that said, let's have our teams introduce themselves, beginning with Team Forestry.
Hi, I'm Vivian Martin, Forestry Department. Hi, my name is Sasheen Edwards, Team Captain for the Forestry Department.
Hi, I am Tanique Williams, Forestry Department.
Hi, I'm Andre Stevenson, Forestry Department.
So from ensuring that our trees and environment is all good to ensuring our students are getting access to technology. Team E-Learning, please introduce yourselves.
Good day, Jamaica. My name is Akim Fraser.
Hi, everyone. My name is Sanjay Dixon.
Hello, I'm Andre Bryan.
Hi, I'm Miriam Nelson Lovelace.
Thank you so very much, teams. So let's get straight into the action. In this section, teams will be asked questions alternately with 10 seconds to answer. Each correct answer is worth 1 point. And with that said, we begin with Team Forestry. Why is a balanced diet important?
To prevent diseases and to get proper nutrition.
To prevent diseases and get proper nutrition.
We'll take it. Provides all necessary nutrients for optimal health and function. Team E-Learning, what are CD4 cells?
Yes. CD4 cells are white blood cells that help to fight diseases, help the immune system.
We'll take it. White blood cells that protect the immune system. That's correct. Team Forestry, what is a simple action you can take at the dinner table to reduce sodium?
Less processed food.
Looking at our judges, will we take it? And I see a nod in the affirmative. We have removing the salt shaker from the table, but we'll take that one. Now time for your question. E-learning, canned and processed foods contain a lot of which substance that can be related to high blood pressure?
Sodium.
Sodium or salt, that's correct. Forestry, why prevent HIV during pregnancy? Why should we do that?
Because it
can be passed to the baby.
Because there's a risk of mother-to-child transmission, and that's higher in that period. That's correct. Team E-Learning, which cancer had the highest number of deaths in Jamaican males in 2022?
Prostate cancer.
That's correct. Team Forestry, what is one risk for prostate cancer?
Age.
We'll take it. We'll also think about it being hereditary. That's another possible answer. That's correct. Team E-Learning, your question. Name one complication of uncontrolled diabetes affecting the kidneys.
Slow healing of wounds. So.
Slow healing of wounds.
Incorrect. Diabetic nephropathy. That's the answer we're looking for. Remember, affecting the kidneys particularly. Team Forestry, drunk driving is responsible for what percentage of road traffic deaths globally?
70%?
Incorrect. Roughly 27%. Back to you, Team E-Learning. What is cancer?
The cells. Abnormal growth of the cells.
We'll take it. A group of diseases where abnormal cells grow out of control. Team Forestry, which body part is strengthened by calf raises?
Calf.
Absolutely correct. E-Learning, which nutrient is essential for muscle repair?
Protein.
That's correct. Team Forestry, true or false? During the first 6 months of birth, babies should be given food and water alongside breast milk.
False.
False.
Absolutely false. Breast milk provides all the nutrients needed by the baby. Team e-learning, your question: what is an undetectable viral load?
It's a viral load in which it is too low to be detected, prevents transmission.
So when HIV is so low, it can't be detected by tests, but is not cured. That is correct. Team Forestry, at what age is it recommended solid food should be gradually introduced in addition to breast milk?
6 months.
That's correct. Team e-learning, to reduce sodium, you should prioritize eating what?
Sodium, less salt,
Less salt, fruits and vegetables.
I'm looking at my judges. Will they accept? They'll take it. We're also looking for fresh, minimally processed foods, but we'll take your answer. Team Forestry, which type of fat is considered healthy for the heart?
Unsaturated fat.
That's right. Team e-learning, which mineral is lost most through sweat?
Water.
Incorrect. Water is not a mineral. Sodium is what we're looking for. Team Forestry, what is the third most frequent cancer in females and how many new cases were there?
Lung cancer.
Incorrect. Cervix uteri is the third most frequent cancer with 376 new cases. All right. Team e-learning, you still get to answer that question to balance out. What is viral suppression?
Medication used to pretty much reduce the viral load.
Incorrect. We're looking for HIV reduced to undetectable levels by antiretrovirals, ARVs. And that's it for section 1. We're going to take a quick break to double check those scores. When we return, I'll give you the latest scores and we'll head straight into the speed challenge. So don't go anywhere. Now is the time to go get your not so heavily sweetened beverage or some water, and we'll be right back. Stay with us. Welcome back. Thank you so very much for staying with us. This is the fourth quarterfinal match in our Health Knowledge Quiz Competition 2026. The scores are Forestry Department on 8 points and E-Learning Jamaica on 7 points. So it's pretty close. And guess what? We're going to head into our speed challenge. In this section, teams will get they'll get 2 separate 60-second periods to answer as many questions as possible. And of course, 1 point for each correct answer. And we'll see how the scores will go after this. So with 60 seconds on the clock, we'll begin with Team Forestry. What's the main cause of shin splints?
Pass.
Overuse of leg muscles. Name an effective method of reducing sodium intake when cooking.
Less salt.
Use less salt.
Judges, will we take that one? Yes, we will, using herbs and spices to flavor instead of salt, but we'll take less salt. Which cancer had the highest number of deaths in Jamaican females in 2022?
Breast cancer.
That's correct. Smoking is a risk factor for?
Obesity.
Not quite. Stroke or kidney or chronic kidney disease. Chronic kidney disease progression can be slowed by doing what?
Less salt, eating less sodium.
Not quite. We're looking for regular exercise and diet control. What is PrEP? What is the meaning of PrEP?
Pre-exposure prophylaxis.
That's correct. How can you reduce saturated fat in your diet?
Checking the label. Nutrition facts.
Not quite. Choose lean meats. What is the name for the passage that connects the colon to the anus? Don't have time for that. The answer we're looking for is the rectum. That's the end of your 60 seconds. It's now time for your 60 seconds Team E-Learning. How often should adults exercise for weight loss management?
5 days a week.
30 minutes daily.
Complete. So 60 to 90 minutes per day, 5 days a week. Which 2 numbers are commonly checked at wellness visits besides weight?
Blood pressure.
Sugar, cholesterol. Sugar, cholesterol.
Incorrect. It's blood pressure and blood glucose. Your next question. Active people are at lower risk of dash.
Obesity.
Non-communicable diseases.
NCDs will take it, or chronic diseases. What is the second most common cancer in males in Jamaica?
Prostate.
Incorrect. Colorectal cancer. True or false? I tell if a person has HIV by the way they look. That's absolutely false. Many people show no visible symptoms for years. What is, and we don't have time for that, or any more questions. That's the end of your 60 seconds and the end of section 2. So, of course, we're going to take another quick break. When we come back, we'll get into the ding-dong buzzer section, and that will determine our winner for today's quarterfinal. Please stay with us. We'll be right back. Hello and welcome back to quarterfinal action here in the Health Knowledge Quiz Competition brought to you by the Ministry of Health and Wellness through its Jamaica Moves program. In this match, we have the Forestry Department and they're on 11 points up against Team E-Learning Jamaica and they're just 1 point behind on 10 points. But guess what? We are now down to the final challenge. It's the buzzer section. It all comes down to this really. Teams will be asked questions and the first team to buzz in and wait to be identified. Once their answer is correct, they'll get 2 points. But if their answer is incorrect or incomplete, they will lose 1 point. So it's risk or reward. So with the time on the clock, we begin with our first question. Which activity best improves lung capacity? Team Forestry?
Cardiovascular activity.
Cardiovascular activities.
Not quite. I'm looking at my judge. The answer we're looking for is aerobic activities. That's incorrect. How soon will, next question, true or false, vitamins are a good source of energy? Team Forestry?
False.
That's correct. Name one sign of low blood sugar. Team Forestry?
Dizziness.
Correct. Shakiness or sweating is another. What is the medical term for cancer affecting the large intestine or the rectum? Team Forestry?
Colorectal cancer.
That's correct. What is the treatment for advanced colorectal cancer that uses high energy rays? Forestry?
Radiotherapy.
That's correct. What is the viral load related to HIV? It's the amount of HIV in the blood. Which organ is primarily affected by chronic kidney disease, CKD? Team E-Learning?
Lungs?
Incorrect. It's the kidney. What are good sources of dietary fiber? Team Forestry?
Fruits and vegetables.
That's correct. What if I want to stop taking PrEP? What will happen? Team Forestry?
Nothing. You just stop if you want to.
The response given that they could just stop if they want to, but the preferred answer is consult a provider, continues 7 days after last exposure. So we won't take that one, Team Forestry. Next question, which muscle group is targeted by sit-ups? Team Forestry?
Abdominals.
Abdominals, that's correct. Which popular Jamaican male politician has shared his battle with breast cancer? Ronald Thwaites and also Michael Manley. Road traffic crash prevention includes what? Team Forestry?
Reducing alcohol abuse.
I see our judges saying they'll take it. We'll also take obeying speed limits and traffic signals. Why take ARVs at the same time daily? Team Forestry?
To increase efficacy.
Sure, or consistency keeps the virus suppressed. How often should flexibility exercises be performed? At least 2 to 3 days per week. How many new cancer cases were there in females in Jamaica in 2022? Team E-Learning?
1,327.
1,300.
No, 300 something. 300 something. 370 something.
Incorrect. It's 3,787. Chronic kidney disease, CKD, can be diagnosed with blood or urine tests. Name one complication of uncontrolled diabetes affecting the nerves. Team Forestry?
Necrosis?
No, nope. We can't take that one. Diabetic neuropathy is what we're looking for. What are the top 3 leading cancers ranked by cases for both sexes in Jamaica? Team e-learning.
Breast cancer,
Prostate cancer,
prostate,
and colorectal cancer.
Incorrect. It's actually prostate first, then breast, then colorectum. What does the acronym FAST in stroke recognition stand for? It's face, arm, speech, time. Which part of the body benefits from squats? Team forestry.
The quads. It's the quads. The glutes and the quads.
Looking at my judge, that sounds quite about it. We'll take it. Legs is another preferred answer, but of course you're more accurate. And that is the end of the final challenge and the end of the final quarterfinal match. So of course we're going to take a quick break. Don't go anywhere. When we come back, I'll tell you which team will move on to the semi-final round of our historic health knowledge quiz competition. The very first of its kind, brought to you by the Ministry of Health and Wellness. We'll be right back. Welcome back. Thank you so very much for staying with us. This is our final quarter-final match in the Health Knowledge Quiz competition brought to you by the Ministry of Health and Wellness through their Jamaica Moves campaign. And of course, this match was between Forestry Department and eLearning Jamaica. And the final scores are eLearning Jamaica on 10 points and the Forestry Department on 34 points. So congratulations to Team Forestry Department and well tried Team eLearning. So at this time, we invite the captains of both teams to come forward and show us some good sportsmanship in keeping with the quiz tradition. Thank you so very much, captains. Now, with that said, today marked all of our quarterfinal matches, and if you were with us from the very start, we're so happy that you stuck with us on the Ministry's YouTube channel. And guess what? You now get the chance to know which teams will face each other on Wednesday, April 22, 2026 for our semi-final action. Are you ready to find out which teams? So if you're with us for the start, that means that there's not much fanfare. But if you're just joining us, here goes. Team Mothers will face Team Seprod, and Team Forestry will meet Team Caribbean Broilers. So we wish the teams all the very best. And of course, we look forward to more exciting action this Wednesday right here on this channel, and we begin at 2 p.m. Of course, this could not be possible without our sponsors, and of course, this is being brought to you once again by the Ministry of Health and Wellness through their Jamaica Moves campaign, particularly our Corporate Wellness Challenge 8x8 edition, and this is the 8th challenge in the series. But of course, we say thanks to our kind sponsors, National Housing Trust, NHT. We say thanks to the National Health Fund. Thank you so very much to Sagicor Life Jamaica. We also thank Lifespan Water and our friends at IGL. We also want to say a very special thanks to the team at Creative Factory. Of course, they are our key production support, and we thank them for ensuring that we could come to you this afternoon, and we'll see you on Wednesday. So until next time, my name is Javon Keys. Take care, be safe.